Hi, this is Dr. Parikh from Ascot Family Dental. Hope you guys are doing good, staying safe, staying home. Um, I wanted to do this quick video because while I was talking to some of our patients recently, a lot of them asked me about some of the questions like, how we are dealing with this, uh, COVID virus in our office, what we are doing in our office regarding that. So I wanted to quickly kind of go over this with you. Um, so, so just even before you come into our office, we are doing something to make sure you guys are safe. First of all, we have requested all our team members who are experiencing flu-like symptoms or any kind of illness to not come to work. At the same time, we are asking them to self-monitor and alert and be alert if they have any respiratory symptoms. We have removed all the magazines, reading materials, toys, and other objects that may be touched by others and which are not easily disinfected. Signage in the treatment rooms are placed instructing the patients on the standard recommendations for respiratory etiquettes and social distancing. We have conducted a thorough inventory and we want to make sure that we are stocked up with personal protective equipments like N95 masks, surgical gloves, gowns, and face shields to make sure that our team is protected, but at the same time we don't transmit the disease. We are requesting all the patients to not bring any companions to their appointment except for the instances when the patient requires assistance. And if they're going to bring any special companion, then we want to go ahead and make sure that they don't have any kind of flu-like symptoms and whatnot. We are doing a pre-screening phone call. You probably know, like, there was a recommendation made on March 26th for the dentists nationwide to postpone all elective procedure and concentrating on emergency dental care only. Because of this, we have rescheduled a lot of our patients, postponed a lot of our patient appointments. I want to go ahead and say thank you so much for your understanding. Thank you so much for your patience during this time. I know some of the patients, we had to reschedule their appointment twice or three times because we did not know when this guideline is going to end. Meanwhile, if you have a toothache or if you have any kind of dental emergency, give us a call at 916-782-3129. Either me or my team member will be there to help you. We'll be asking you, a few basic COVID screening questions and then dental related questions. This is one of our way to find out if the problem is something that can be addressed over the phone by prescribing some medication. Is this something that can be waited out? Or is this something that needs to be taken care of immediately? This way, we minimize the risk of disease transmission. We are recommending that only asymptomatic patients or the patients who have tested negative for COVID-19 or patients have recovered after 2 weeks since the resolution of signs and symptoms be seen at our office. This what it means is that if you're experiencing any flu-like symptoms, you are better off going first to your primary care physician or an emergency care facility where they have facility that is equipped to take care of you. Now, during your dental care, upon arrival, we ask you to directly proceed to the treatment room prepared for you. This way, you are seated in a sterile and disinfected room where appropriate social distancing guideline will be followed. We ask that you not sit in our reception area, not because it's not clean, but we want to make sure that we follow that 6 feet of social distancing. Also, at the same time, we are making sure that if we are scheduling patients, we are not scheduling patients back to back, or we are not scheduling patients in such a way that there will be a lot of multiple patients at the same time in the waiting area. Our dental health care professionals, they follow strict universal precautions. What it means is that we follow infection prevention practices for all our patient care, regardless of a patient is suspected or has a confirmed infection status. This includes, hand hygiene, use of personal protective equipment, respiratory etiquettes, sharp safety, using sterile instruments and devices, clean and disinfection of environmental surfaces. Like, since they have found out that virus may be vulnerable to oxidation, so you will be asked that when you come in to use a 1.5% hydrogen peroxide mouthwash rinse prior to us doing your dental evaluation. We'll also measure your body temperature and ask you to fill out a COVID questionnaire. Now, we may take some extra oral radiographs, as an alternative to intraoral radiographs, as intraoral radiographs can stimulate coughing. So we might ask you to do that. We may not, but this is also an option that we can do. You might have a question like, what is considered dental care emergency? What is considered non-dental care emergency? So this is a guideline that we pulled out from American Dental Association's webpage. So something that can be rescheduled is this: regular visits for exam, cleaning, and x-rays, regular visits for braces, removal of teeth that aren't painful, treatment of cavities that aren't painful, teeth whitening. All these treatments should be rescheduled. Dental care you should have evaluated by dentist at this time should be bleeding that does not stop, painful swelling in or around your mouth, pain in a tooth, teeth, or jawbone, gum infection with pain or swelling, after surgical treatment like dressing or stitch removal, broken or knocked out teeth. If you have stuff like that, just give us a call. I think it's not a bad idea to have it, have a conversation with me at this time. After your appointment, in light of current controversy regarding, whether ibuprofen should be used or not with the COVID-19 patients or infection, we are recommending to avoid using ibuprofen. Instead, there are other pain medication that work just fine, like Tylenol or Aleve. So we'll be recommending you use that. In our office, all disposable equipments are tossed after each use. The equipments that are non-disposable are sterilized and disinfected according to the manufacturer's instructions. We are using EPA-registered hospital-grade disinfectant to frequently touch surfaces or objects for appropriate contact times as indicated on the product's label. Surfaces such as door handles, chairs, desks, and bathrooms are cleaned and disinfected frequently. And at the end of the appointment or at the end of the day, when our team members go home, we ask them that, to take off shoes, remove and wash clothing separately from household residents and immediately shower. Again, this is all in compliance with American Dental Association's current guidelines. Now, thank you, first of all, to all our patients for your understanding and your patience during this time. We want to thank all the healthcare workers who are working right now. Also very grateful for some of the essential business workers who are working to keep all the rest of us moving along during this crazy times. I came across this really nice quote. It says, the mind is its own place and in itself can make a heaven of hell and a hell of heaven. This was from a poem by Milton, Paradise Lost. Really, really good, really something good that we need to think about during this time. Again, thank you so much. Stay positive and stay safe. Have a wonderful rest of it.